Dr. Michael Torres had worked alongside nurse Patricia Williams for 8 months at the VA Medical Center. She was skilled, compassionate, and had an uncanny ability to connect with wounded veterans, until the night her sleeve rolled up during an emergency, and he saw the silver star tattoo on her wrist. Suddenly, everything about the best nurse on the night shift made perfect sense. Welcome to Daily Soldier Stories. Before we continue this incredible story of hidden valor and healing, tell me in the comments from which city in the world are you watching this video today. And if you believe heroes come in many forms, hit that subscribe button to support the channel. The night shift at the Phoenix 5 Medical Center began at 11 p.m. and ended at 7 a.m. 8 hours that often felt like 8 days for the nurses and doctors responsible for caring for America's wounded veterans during the hospital's quietest and most vulnerable hours. Patricia Williams had been working the night shift for exactly 8 months and 2 days. At 34, she moved through Ward 3 with the kind of quiet efficiency that distinguished great nurses from merely competent ones. She never seemed hurried, never appeared overwhelmed, and somehow managed to be exactly where she needed to be whenever a crisis emerged. Her patients adored her. Veterans who had been difficult for other nurses, angry, uncooperative, suspicious of civilian medical staff, responded differently to Patricia. She had a way of talking to them that cut through their defenses, a manner of touch that conveyed both professional competence and personal understanding. "She just gets it," Staff Sergeant Rodriguez had told Dr. Torres during a routine checkup. Rodriguez had lost his left leg to an IED in Kandahar and had been hostile to most of the medical staff since his admission. "Nurse Williams talks to me like she knows what it's like over there." Dr. Torres had noticed the same thing. In his 5 years at the VA, he'd worked with dozens of excellent nurses, but Patricia Williams was different. When she spoke to combat veterans about their injuries, their nightmares, their struggles with adaptation, there was something in her voice that suggested personal experience rather than just professional training. She worked the most challenging cases without complaint, the traumatic brain injury patients who became confused and agitated in the middle of the night, the amputees dealing with phantom pain that made sleep impossible, the PTSD patients who woke up screaming from nightmares about firefights and roadside bombs. Patricia handled them all with the same calm competence, but more than that, she handled them with an understanding that seemed to go beyond anything she could have learned in nursing school. Other staff members had theories about Patricia's background. Some thought she might be a military spouse, someone who had lived on bases and understood military culture through proximity. Others speculated that she might have family members who had served, giving her insight into the veteran experience. Dr. Torres had his own theory. Patricia Williams was former military herself. Everything about her suggested it, the way she stood, the precision of her movements, her ability to remain calm under pressure, and most tellingly, the way she communicated with veteran patients as if she spoke their language fluently. But when he'd asked her directly about military service during her first week on the job, Patricia had simply said, "I've always been drawn to helping veterans. It feels like the right place for me to be." The answer had been polite but deflective, and Dr. Torres had learned not to push. The VA employed many people who preferred to keep their personal histories private, and Patricia Williams was entitled to the same discretion as anyone else. What mattered was that she was the best night shift nurse the ward had seen in years, and her patients were healing faster and adapting better because of her care. Tuesday night, November 15th, started like any other shift. Patricia arrived at 10:45 p.m., received report from the day nurse, and began her rounds through Ward 3's 28 beds. Most patients were sleeping. Some were watching late-night television with headphones. A few were reading or talking quietly with family members who had stayed past visiting hours. Room 312 housed Master Sergeant James Mitchell, a 38-year-old career soldier who had been admitted 3 days earlier with complications from a gunshot wound he'd sustained in Syria 6 months prior. The original injury had healed, but infection had set in, requiring IV antibiotics and close monitoring. Mitchell was one of Patricia's more challenging patients, not because he was uncooperative, but because he was clearly struggling with depression and survivor's guilt. His unit had been ambushed, and 3 soldiers had been killed in the firefight that left him wounded. He blamed himself for surviving when others hadn't, and he'd made it clear to the staff that he wasn't sure he wanted to recover. Patricia had been working with Mitchell since his admission, slowly building trust and trying to help him process his trauma. Progress was minimal, but she'd seen enough combat veterans to know that healing took time and couldn't be rushed. At 2:47 a.m., Patricia was updating charts at the nurses' station when the cardiac monitor alarm from room 312 began blaring. She looked up to see Mitchell's vital signs on the central monitoring system showing dangerous irregularities. His heart rate was climbing rapidly while his blood pressure was dropping. Patricia reached Mitchell's room in seconds, finding him conscious but in obvious distress, clutching his chest and struggling to breathe. His face was gray, his skin was clammy, and the monitor showed he was going into cardiac arrest. "Call doctor." "Torres," Patricia called to the charge nurse while she began positioning Mitchell for CPR. "Get the crash cart and call respiratory." As Mitchell's condition deteriorated, Patricia began chest compressions with the precise rhythm she'd learned in nursing school, but perfected somewhere else entirely. Her movements were automatic, controlled, efficient, not the careful technique of someone who had practiced on mannequins, but the instinctive response of someone who had performed CPR under much more difficult circumstances. Dr. Torres arrived within minutes, followed by the code team with emergency equipment. Patricia smoothly transitioned from solo CPR to team leader, coordinating the response with an authority that seemed to surprise even herself. "He's been stable for 3 days," she reported while continuing compressions. "No previous cardiac symptoms, no medication changes. This came out of nowhere." As the team worked to stabilize Mitchell, Patricia's scrub top rode up slightly, revealing the edge of a tattoo on her left wrist. In the chaos of the emergency, no one noticed except Dr. Torres, who caught a glimpse of what looked like a star surrounded by text. It took 20 minutes to stabilize Mitchell and get him transferred to the cardiac intensive care unit. As the excitement died down and the team dispersed, Dr. Torres found himself thinking about what he'd seen on Patricia's wrist. It had looked like a military decoration, though he couldn't be sure in the poor lighting and brief glimpse. But something about the way Patricia had handled the emergency, her calm under pressure, her natural leadership, her precise execution of life-saving procedures, reinforced his suspicion that there was more to her background than she'd revealed. 3 days later, Mitchell had recovered enough to return to Ward 3, though he was now on cardiac monitoring and restricted activity. The near-death experience had shaken him, but it had also seemed to break through some of his depression. For the first time since his admission, he was talking about going home and getting back to his life. "Nurse Williams," Mitchell said when Patricia checked on him during her rounds, "I wanted to thank you for what you did the other night. The doctor told me you probably saved my life." Patricia smiled and adjusted his IV line. "Just doing my job, Sergeant." "How are you feeling?" "Better. Scared, but better." Mitchell looked at her carefully. "Can I ask you something?" "Of course." "You've been in combat, haven't you?" Patricia's hand stilled on the IV tubing. "What makes you say that?" "The way you talked to us, the way you handled that emergency." "I've been around long enough to recognize someone who's been there." Mitchell's voice was quiet but certain. "You don't learn that kind of calm in nursing school." Patricia was quiet for a moment, perhaps debating how much to reveal. Finally, she nodded slightly. "Army medic, 3 deployments to Afghanistan." "I knew it," Mitchell said. "What unit?" Patricia hesitated again. 10th Mountain Division, forward operating bases in Helmand Province." Dr. Torres, who had been approaching the room to check on Mitchell, stopped outside the door when he heard the conversation. He didn't mean to eavesdrop, but something about Patricia's tone suggested this was the first time she'd talked about her military service with anyone at the hospital. "That was rough territory," Mitchell said. "When were you there?" 2009 to 2011, then again in 2013. Patricia's voice carried the weight of memories she rarely shared. "It was intense." "Is that why you became a nurse, after you got out?" Patricia looked out the window at the desert landscape surrounding Phoenix. "I didn't exactly choose to get out. IED took out our convoy on my last deployment. I was medevaced with traumatic brain injury and multiple fractures, medical retirement." "I'm sorry." "Don't be. I lived. 5 others in that convoy didn't." Patricia's voice was matter-of-fact, but Dr. Torres could hear the emotion underneath. Coming to work here, it feels like continuing the mission, taking care of soldiers, just in a different capacity. Mitchell nodded. That makes sense. But there's something else, isn't there? Something you're not telling me. Patricia looked at him sharply. What do you mean? The other nurses, they're good people, but they don't understand what we've been through. You do. Not just because you served, but because you've been where we are. Broken, trying to put the pieces back together. Dr. Torres realized that Mitchell had identified something that had been nagging at him for months. Patricia didn't just understand combat veterans. She understood wounded combat veterans with the intimacy of someone who had walked the same path. Patricia was quiet for a long moment. When she spoke, her voice was barely above a whisper. After I was wounded, I spent 8 months at Walter Reed. Surgery after surgery, physical therapy, occupational therapy, psychological counseling. I know what it's like to lie in a hospital bed wondering if you'll ever be the same person you were before. She paused, then continued. I know what it's like to feel guilty for surviving when others didn't. I know what it's like to have nightmares about the convoy, about the explosion, about the faces of the soldiers who didn't make it home. But you made it through, Mitchell said. I made it through because I had people who understood what I was going through. Nurses and doctors who had been there themselves, or who at least took the time to learn what combat trauma really meant. Patricia looked directly at Mitchell. Now I try to be that person for others. Dr. Torres stepped back from the doorway, processing what he'd heard. Patricia Williams wasn't just a former combat medic. She was a wounded warrior who had turned her own healing journey into a mission to help others heal. But there was still something about the tattoo he'd glimpsed during the emergency. If Patricia had been wounded and medically retired, why would she have a Silver Star tattoo? The Silver Star was awarded for exceptional gallantry in action against an enemy of the United States, not the kind of decoration typically associated with being wounded by an IED. Unless there was more to her story than she was telling. Dr. Torres didn't bring up what he'd overheard, but Patricia's conversation with Mitchell had changed something. Over the following weeks, she became more open about her military background with both patients and staff. Not dramatically, she wasn't someone who sought attention, but she stopped deflecting questions about her service. Other veterans on the ward began approaching her with stories and questions they'd never shared with civilian medical staff. Patricia listened with the patience of someone who understood that sometimes healing required talking about things that were too painful to discuss with people who hadn't lived through similar experiences. Her effectiveness as a nurse, already impressive, reached new levels. Patients who had been resistant to treatment began cooperating. Veterans who had been withdrawn and isolated started participating in group therapy sessions. The overall atmosphere on Ward 3 improved noticeably. Dr. Torres watched these changes with growing curiosity about Patricia's complete story. Former combat medics didn't usually become civilian nurses. Most who stayed in healthcare went to work for the VA or other veterans organizations, but in administrative or counseling roles. The transition from battlefield medicine to hospital nursing was unusual. More puzzling was the question of the Silver Star. Dr. Torres had looked up the decoration's criteria, and it was awarded for actions that went far beyond the normal duties of a combat medic. If Patricia had earned the Silver Star, it meant she had done something extraordinary under fire, something she hadn't mentioned in her conversations about her service. The opportunity to learn more came during a particularly busy night in late December. The emergency department had sent up 3 new admissions, all veterans, all dealing with complications from combat injuries sustained years earlier. The understaffed night shift was stretched thin, and Patricia was working with her usual calm efficiency to get everyone settled and stabilized. One of the new patients, a Marine named Santos who had lost both legs in Afghanistan, was having a panic attack triggered by the hospital environment. He was hyperventilating, thrashing in his bed, and becoming increasingly agitated despite the staff's attempts to calm him. Patricia approached Santos with the same steady demeanor she brought to every crisis. She sat on the edge of his bed, ignoring his flailing arms, and began speaking to him in a voice that was barely above a whisper. "Santos, look at me. You're safe. You're in Phoenix, Arizona, at the VA hospital. There are no mortars, no snipers, no IEDs. Just look at me and breathe." Santos's eyes found Patricia's face, and gradually his breathing began to slow. "That's right," Patricia continued. "You're safe. I know it doesn't feel like it, but you are. I'm going to stay right here with you until you're ready." As Patricia worked to calm Santos, she absently pushed up the sleeves of her scrub top to get them out of the way. That's when Dr. Torres saw it clearly for the first time. The tattoo on her left wrist wasn't just a silver star, it was an exact replica of the medal, complete with the inscription around the edge. But tattoos of military decorations were common among veterans. What made Dr. Torres look twice was the detail and precision of the artwork. This wasn't a generic representation of the silver star. It was a specific rendering that included elements he'd never seen before. Later that night, when the crisis had passed and Santos was sleeping peacefully, Dr. Torres approached Patricia at the nurse's station. "That was impressive," he said, "the way you handled Santos." Patricia looked up from her charting. "Panic attacks are tough, but they pass if you stay calm and give the person something to focus on. You've dealt with them before." "More than I'd like to remember." Patricia's tone suggested she was thinking about her own experiences as well as her patients. Dr. Torres hesitated, then decided to ask the question that had been nagging at him for weeks. "Patricia, can I ask about your tattoo? The silver star on your wrist?" Patricia's hand unconsciously moved to cover her wrist. "What about it?" "It's very detailed, very specific. Most tattoos of military decorations are more artistic interpretations." Patricia was quiet for a moment, perhaps deciding how much to reveal. "It's not an interpretation," she said finally. "It's an exact copy of my silver star." Dr. Torres felt his understanding shift again. "Your silver star?" Patricia looked around the ward, perhaps checking that no patients or other staff members were within earshot. October 15th, 2013. Forward Operating Base Chapman, Helmand Province. Taliban fighters overran our perimeter during a coordinated attack. I was the only medic on base when the casualty reports started coming in. She paused, her eyes focused on something beyond the hospital walls. 17 wounded soldiers, some of them critical. The aid station took a direct hit from a mortar round early in the fighting, so I was treating people wherever I could find cover, behind vehicles, in bunkers, even in the open when there was no choice. Dr. Torres listened without interrupting, understanding that Patricia was sharing something she rarely talked about. The evacuation helicopters couldn't land because of the incoming fire, so I had to keep people alive for 6 hours until the attack was repelled and medevac could get through. I used up all our medical supplies in the first 2 hours and had to improvise with whatever I could find. Patricia's voice remained steady, but Dr. Torres could see the emotion in her eyes. 3 soldiers would have died if I hadn't been able to stabilize them during the firefight. The Silver Star citation says I repeatedly exposed myself to enemy fire to provide life-saving medical treatment. What it doesn't say is that I was terrified every second of those 6 hours. But you did it anyway. I did my job. That's what medics do. We go where the wounded are, regardless of what's happening around us. Dr. Torres nodded, finally understanding why Patricia Williams was so effective with combat veterans. She wasn't just someone who understood their experiences. She was someone who had lived those experiences at the highest level, under the most extreme circumstances. "Is that when you were wounded, during that attack?" Patricia shook her head. "That was 3 weeks later. Different convoy, different IED. By then, I thought I was invincible." Her smile was rueful. "The Army taught me otherwise." Word of Patricia's Silver Star spread through Ward 3 gradually, not as gossip but as a recognition that needed to be shared. Veterans who had been struggling with their own wounds began approaching her with questions and stories that went beyond medical concerns. Staff Sergeant Davis, who had been withdrawn and uncommunicative since losing his right arm in Iraq, started talking about his fears of being unable to provide for his family. Patricia listened, shared her own struggles with adapting to life after injury, and helped him connect with vocational rehabilitation services. Corporal Martinez, whose traumatic brain injury had left him with memory problems and mood swings, began participating in cognitive therapy after Patricia described her own TBI recovery and the strategies that had helped her cope. Most significantly, Master Sergeant Mitchell, whose cardiac emergency had led to Patricia's first conversation about her military service, had become an advocate for other struggling veterans on the ward. His brush with death, combined with Patricia's example of finding purpose after trauma, had given him a reason to keep fighting. The changes weren't lost on the hospital administration. Ward 3's patient satisfaction scores reached record highs. Veterans were staying in treatment longer and completing their recovery programs at higher rates. The atmosphere throughout the entire night shift had improved noticeably. Dr. Torres documented these improvements in his quarterly report, though he was careful not to attribute them solely to Patricia's influence. Healing was complex, and many factors contributed to patient outcomes. But there was no denying that having a Silver Star recipient on the nursing staff had made a difference in ways that couldn't be measured by standard metrics. More importantly, Patricia herself seemed to be healing. The careful guardedness that had characterized her first months at the hospital had given way to something more open and confident. She was still professional and focused, but there was less weight in her shoulders, less shadow in her eyes. "I think helping other people heal has helped me heal," Patricia told Dr. Torres during one of their conversations about patient care. "For the longest time after I was wounded, I felt like my military career had ended without me accomplishing everything I was supposed to accomplish. And now? Now I think maybe this is what I was supposed to accomplish. Maybe getting wounded wasn't the end of my mission. Maybe it was the beginning of a different kind of mission." Dr. Torres understood what she meant. The Patricia Williams, who worked the night shift at the Phoenix 5A, wasn't the same person as the combat medic who had earned the Silver Star in Afghanistan. But she was the person that combat medic had become, shaped by her experiences, but not defined by them. 6 months after Dr. Torres first saw Patricia's Silver Star tattoo, the hospital held its annual Veterans Day ceremony. The event was designed to honor both the patients receiving care and the veteran employees who provided that care. Hospital administrators had asked Patricia to speak at the ceremony, but she had declined, preferring to let her work speak for itself. However, Dr. Torres had submitted a nomination for her to receive the hospital's Excellence in Patient Care Award, and she had been selected as the recipient. The ceremony was held in the hospital's main auditorium with patients, families, and staff in attendance. Patricia sat in the front row with other award recipients, wearing her dress uniform for the first time since her medical retirement ceremony 5 years earlier. When her name was called, Patricia walked to the podium with the same calm confidence she brought to patient care. The Silver Star was visible on her uniform, but it wasn't the focus of attention. She was. "When I was wounded in Afghanistan," Patricia began, "I thought my ability to serve was over. I thought being medically retired meant I couldn't continue the mission I'd trained for my entire adult life." She looked out at the audience, making eye contact with veteran patients she'd cared for over the past year. "What I learned here is that the mission doesn't end when you take off the uniform. It evolves. The skills I learned as a combat medic, staying calm under pressure, making life or death decisions quickly, never leaving anyone behind, those skills transferred to civilian nursing." Patricia paused, her voice becoming stronger. "But more than that, the experience of being wounded, of being a patient, of struggling with recovery, that experience helps me understand what our veterans are going through in ways that textbooks and training programs never could." She gestured toward the audience. "Every person in this room has served our country with honor. Some of you served in uniform, some of you serve now as caregivers and medical professionals. All of you have contributed to something bigger than yourselves." Patricia's closing was simple but powerful. "The mission continues. It just looks different than we expected. Thank you." The applause was sustained and genuine, but what struck Dr. Torres most was the reaction of the veteran patients in the audience. They weren't just clapping, they were saluting, some sitting in wheelchairs, some missing limbs, all honoring someone who had walked the same path they were walking. After the ceremony, Patricia was surrounded by patients, families, and staff who wanted to thank her for her service, both military and medical. She accepted the recognition with the same grace she brought to everything else, acknowledging that she was part of a team rather than an individual hero. Later, as the crowd dispersed, Dr. Torres approached Patricia. "That was well said," he told her. "It was honest," Patricia replied. This work, taking care of veterans, it's not just a job. It's a continuation of what I swore to do when I enlisted. To protect and serve, to take care of soldiers. The location changed, the uniform changed, but the mission is the same. Dr. Torres nodded, understanding that he wasn't just working with an excellent nurse. He was working with someone whose entire life had been dedicated to service, who had found a way to continue that service even after being wounded in the line of duty. 2 years later, Patricia Williams was promoted to nurse manager for the night shift at the Phoenix 5A Medical Center. Her ward had become a model for other VA hospitals, and she was frequently asked to speak at conferences about treating combat veterans with combat trauma. She still worked the night shift by choice, still connected with veteran patients in ways that went beyond medical care, and still wore the silver star tattoo that had started the conversation about her military service. But perhaps most importantly, she had mentored 3 other veteran nurses who had joined the staff, all former combat medics who had found their way to civilian health care and needed guidance on how to use their military experience in a medical setting. The circle continues, Patricia told Dr. Torres during one of their regular conversations about patient care. Veterans taking care of veterans, all of us finding ways to keep serving even after we take off the uniform. Master Sergeant Mitchell, whose cardiac emergency had led to Patricia's first conversation about her military background, had completed his recovery and returned to active duty. Before he left, he'd stopped by Ward 3 to thank Patricia for saving his life, not just medically, but emotionally and spiritually. "You showed me that being wounded doesn't mean being broken," he'd told her, "that surviving doesn't mean you have to feel guilty, that there are still ways to serve, still ways to make a difference." Staff Sergeant Davis, who had lost his arm in Iraq, had completed a vocational rehabilitation program and was working as a counselor for other disabled veterans. Corporal Martinez had recovered from his traumatic brain injury enough to return to school and was studying to become a nurse himself. The impact wasn't measurable in traditional ways, but it was real and lasting. Veterans were healing faster, adapting better, and finding purpose in their post-military lives because they were being cared for by someone who understood their journey from the inside. Dr. Torres had learned something important about healthcare during his time working with Patricia. Medical knowledge and technical skills were essential, but they weren't sufficient. The best healing happened when patients were cared for by people who understood not just their medical conditions, but their human experience. Patricia Williams had earned the Silver Star for extraordinary heroism under fire, for staying calm in chaos and saving lives when everything around her was falling apart. But her greatest achievement might have been realizing that those same qualities, calm under pressure, dedication to others, refusal to give up, could save lives in a different kind of battle. The war had ended for her when she was medically retired, but the mission had never ended. It had just found a new theater of operations where the enemy was despair instead of Taliban fighters, where the weapons were compassion and understanding instead of medical supplies and courage under fire. Some warriors hang up their boots and find civilian careers that have nothing to do with their military service. Others find ways to keep fighting, to keep serving, to keep making a difference in the lives of people who need someone who understands what they've been through. Patricia Williams was the second kind of warrior. The kind who understood that service was a calling, not just a job, and that the uniform might change, but the mission remained the same. Take care of your people, never leave anyone behind, and keep fighting until everyone makes it home safely. Even if home looked different than anyone had expected. This story was brought to you by Daily Soldier Stories. Have you ever discovered that someone caring for you had walked the same difficult path? Share their story in the comments, and if this reminded you that healing often comes from those who have been healed, subscribe to support the channel. Sometimes the best medicine is understanding, and the best healers are those who have been where their patients are going.